Hey everyone, we've talked about the nervous system and the anatomy and physiology and basic function of the nervous system. Now we want to talk a little bit about some of the dysfunctions of the nervous system that can occur. Just a broad overview so you can get a sense of different ways that the disease process can take place in the nervous system, and also become familiar with some of the more common dysfunctions and diseases that affect the nervous system. Now, if we're talking about common injuries and disease to the nervous system, number one has got to be traumatic brain injury. You've probably heard of TBIs or traumatic brain injuries before because they're fairly common. A full 1.4 million people every year in the United States suffer some form of traumatic brain injury. At this point, you might ask sort of, what is a traumatic brain injury, right? Well, it's right there in the description, the title. Traumatic means that it happens by an accident, an impact, some kind of blunt force, etc. Brain injury, that's it. It's just a broad category of injuries to the brain, bruising and damage to the brain that can occur as the result of some kind of accident, fall, car accident, football accident, etc. You're familiar with all these. In the United States, 50,000 people a year die of traumatic brain injuries, and about 250,000 people a year are hospitalized as a result of significant traumatic brain injuries. So the point I want to make here is this is fairly common, and we need to be very careful about it, because up until fairly recently, we largely ignored traumatic brain injuries. It was fairly common when I was growing up for somebody to be on the football field that smacked down hard, helmet-to-helmet impact, and the coach would just yell at him, "Come on, get up, start moving again, let's go," without any regard for an injury that could have happened to the brain. As a result of that, we had several generations of folks that suffered unrecognized traumatic brain injuries unnecessarily. Now we recognize this can be much more significant. And if you are at all, for example, a football fan, then you know that this is the case. Okay, the most common type of traumatic brain injury is a concussion. And what a concussion is damage to the nerves or blood vessels in the brain caused by an impact to the head. As simple as that. So basically, a concussion is a significant bruise to the brain caused by impact. Now, it doesn't necessarily have to be a full-on contact impact. In other words, if you had something, let's say, an explosion, which creates a shock wave, or even a fall where the cranium doesn't actually make impact, it's possible to nevertheless suffer from a traumatic brain injury and even a concussion. And as you'll see in this image, you can also get multiple impacts and injuries to the brain from one accident. So in this case, what this is demonstrating is what's called a coup counter coup impact. Coup just means hit in French. So hit, counter hit. And what that describes is, let's say you're driving in your car at 60 miles an hour. Okay, your cranium is doing 60 miles an hour, the car is doing 60 miles an hour, your brain's doing 60 miles an hour, everybody's happy. Then you hit a light post. Suddenly the car comes from 60 miles an hour to 0 miles an hour in a very short period of time, causing what's called a deceleration injury. Unfortunately, your cranium keeps moving forward, smacks the windshield, and then stops suddenly. Unfortunately, your brain kept moving forward. Your brain was still going at 60 miles an hour, smacked the front of your cranium, and then got pushed back and hits the back of your cranium. So you've actually got a significant injury on either side of your brain. Coup, counter coup. The point here being, you could be in such an injury, look around and think, there's no blood. I feel kind of okay. I think I'm fine. I'm going to go home. That'd be a big mistake. You need to get to the hospital. The same thing could happen, for example, playing, I don't know, football with a helmet on or other sports, right? Baseball where you get smacked with a ball in the head. But let's take football, same thing. You ram into a defensive player, helmet on helmet contact. The helmets were doing, I don't know, 25 miles an hour as they hit each other. Your brain was doing 25 miles an hour. Your brain suddenly stops, smashes against the front of your cranium, and then bounces back and smacks against the back of your cranium. There's no visible signs of injury, but the risk to your health and your life is pretty significant. So in those cases, or a case where maybe you don't have a full impact, maybe you're next to some kind of traumatic shockwave. This is what, of course, happens to soldiers when they're near an explosion. They don't actually get torn apart or injured or have any kind of open wound as a result of the explosion, but their brain takes that shockwave, and it's the same thing. The brain gets slammed into the back of the cranium and then slammed forward again. What's the treatment for this? And this part I actually really want to cover. I don't do a lot of, clinical advice here, but I want to make sure that you understand this because people often get it wrong. And often people will have this old idea, which is terribly outdated, not supported by the evidence, that if you have such an injury, the thing to do is stay awake because if you go to sleep, you may not wake up. That's ridiculous. That's not the case. The thing to do if you have a brain injury is allow the brain to heal. And you do that by allowing the brain to rest. Now that seems to be common sense, but people often miss that. So sometimes folks, students even of mine, they'll come talk to me, will have some kind of potential traumatic brain injury as a result of, sports or something like that. They'll go to the hospital, they'll check them out, and they'll say, okay, go home and just relax for a couple days. And they go home, and what do? They play video games, maybe they read some of the assignments for homework online, etc., stuff like that. Terrible idea. That's not resting your brain. That's resting your legs and arms and other things as you lay there in bed playing a video game. But that's not the part of your body that needs to be rested. The part of your body that needs to be rested is your brain. So the right solution for a potential traumatic brain injury is to go home, dim the lights a bit, relax, and allow your brain to rest. Close your eyes, perhaps listen to gentle music, and just allow your brain to rest. Don't do intense reading. Don't play complicated games. Don't even get on the internet. Don't fiddle around on your phone. Allow your brain to rest. And don't worry about sleeping. Sleeping's fine because sleeping allows your brain to rest. So that is the solution to a traumatic brain injury. That and paying attention so that you understand that if you have a potential traumatic brain injury, if you've taken a hit to the head, you need to deal with it. You need to seek medical advice. Okay, another version of an injury that you've heard of is dementia. And dementia is a cognitive loss in function that relates to things like perhaps easy confusion, inability to focus and concentrate, maybe a modest or significant loss in memory. This is typically associated with older folks, and sure enough, it happens mostly in people over the age of 70 and especially over the age of 80. What causes dementia? Well, there's a lot of different causes. About 10-15% are caused by some form of stroke. We've talked about strokes before. About 15 or so percent are caused by Huntington's disease, Parkinson's disease, etc. And we'll talk about those later today in this video. And then the vast majority are caused by what's called Alzheimer's disease. Alzheimer's disease is by far the leading cause of severe dementia in the United States. It affects about 1% of the total U.S. population, but it affects somewhere around 15 or 20% of those over 80. So it's fairly common and unfortunate in those over 80. And it manifests as things like, again, memory loss, personality changes, anxiety, frustration, inability to concentrate, all those things that you think about when you think of the term dementia. Here's the thing. We don't really know what causes Alzheimer's disease. We know a few things. We know that it has a genetic factor to it, so part of it is heritable. We know that dementia patients with Alzheimer's can have specific genetic dispositions that can lead to early onset Alzheimer's. So we think of Alzheimer's as being an old person disease, but in fact, it can affect people as young as 40 or 45 years old with early onset. And we know, unfortunately, that we haven't yet found an effective treatment for this. And in fact, it's likely that this isn't one singular disease, but it's actually a category of different injuries and dysfunctions to the brain that manifest with similar kinds of symptoms. And we can identify some of the characteristics that happen to the brain that relate to Alzheimer's. So if you look at this image here, you'll see that the upper image is a normal brain, and the lower image is a brain of somebody who has Alzheimer's disease. And you're going to notice right there some pretty significant anatomical changes, right? The ventricles are larger, so those are those large openings within the brain. Those are much larger. There's a gray matter loss, so that's the brain matter around the edges of the brain that is principally the cell bodies of neurons, right, and the dendrites. And you'll see there's also a white matter loss. And it's easy to remember what the white matter is because that is the result of the myelin sheath, that is to say the lipid layers on the axons of the neurons. So that's the area of the brain that's mostly just these conductive pathways or axons. But you'll notice that in the Alzheimer's brain, it's fundamentally changed. And plaques form on the surface of the brain and other sorts of things. So we can identify when a patient is suffering from Alzheimer's, but we don't exactly know what's causing it or in particular how to fully treat it. So what other diseases are out there? Well, I mentioned Parkinson's before. Parkinson's is a nerve cell disorder that is produced by the loss of the nerve cells that create dopamine. You remember dopamine is a neurotransmitter, right? And we talked about neurotransmitters. These are the chemicals that take the signal from the neuron and relay it to the muscle or other tissue where you're expecting an action to take place, right? So neurotransmitters basically transmit neurosignals, hence the title. Dopamine is a particular neurotransmitter. As I mentioned in the last video, there's a bunch of different neurotransmitters, and I told you didn't need to memorize them, but dopamine you might be familiar with because it's a neurotransmitter that allows for muscle movement and control. It's critical to muscle movement. So when you lose dopamine, what are the symptoms? Well, poor muscle control. So somebody with Parkinson's could have tremors, they could have stiffness, they could have slow movement, they could have balance problems. And the balance problems aren't because they're actually having problems managing balance with other parts of their brain and sensors, but because their muscles aren't responding well to the adjustment in tone that's always needed. Remember, we talked about this in the last video, in order to maintain an upright position, right? So what Parkinson's could be related to toxins, for example, as one possibility. In fact, and I'm only bringing this up because I just recently read an article that was talking about how farm workers exposed to pesticides have a higher rate of Parkinson's developing. So that's sort of interesting. Other kinds of characteristics to Parkinson's might be things like, well, difficulty initiating movement, so you're still and then you have trouble sort of moving initially. A shuffling gait, so you have trouble kind of fully using your legs in a normal manner, tremors at rest, and these can also manifest in psychiatric issues, which can be related to actually the disease process physiologically, and can also be related to the emotional strain and stress of living with Parkinson's, things like depression, hallucinations, paranoia, cognitive decline, etc. Besides pesticides as one possibility and other toxins, what else can lead to Parkinson's? Well, the number one cause of Parkinson's is idiopathic. If you've been paying attention at all in these lectures, then you know that idiopathic means we don't really know. So in order to not embarrass ourselves, we don't call it idiopathic, we call it primary Parkinson's. Primary Parkinson's is when we don't quite know what causes it, but we know that we've got this loss in the capacity to manage and produce dopamine. That is by far the most common form of Parkinson's. However, secondary Parkinson's means that it's secondary to something else. And we sometimes call that Parkinsonism. And this could be, as I talked about before, pesticides that could stimulate or trigger Parkinson's. It could be other drug use. It could be a stroke. It could be trauma, like, for example, a blunt force injury to the head. All of these could cause Parkinsonism, Parkinson's-like symptoms. And then there's also a familiar characteristic to it, like with other forms of neurodysfunction. About 20% of the diagnosed cases are the result of some genetic link, some kind of familial connection with Parkinson's. So we know that there's a genetic predisposition toward this. What's interesting to point out here, just as a life lesson, is very frequently Parkinson's is diagnosed way too late. In fact, the typical clinical diagnosis happens when about 68% of the dopamine in the basal ganglia, remember what ganglia means, right? The base ganglia. 80% loss in the basal ganglia has already taken place. And by the way, symptoms only emerge when you've got about 50 or 60% loss, right? So a person might be suffering from symptoms for a few months or a year or so and then finally go to a physician and get a diagnosis. At that point, they could have had a significant decline in dopamine levels for up to 20 years. So we get a diagnosis really late because the symptoms don't emerge till really late. And the symptoms start out very subtle with modest tremors, some loss in motor function that somebody might attribute to whatever, age, injury, fatigue, etc. So it takes a while for folks to come to a doctor and actually seek assistance. So life lesson here is when you're experiencing symptoms, get checked out. Sure, maybe 80% of the time the doctor will say, you're fine, you're just tired. But the other 20% of the time, that physician may save your life. Here's an image of Parkinson's, and what you're going to notice there in this PET scan is that the normal brain on the top part there has some pretty significant activity in the basal ganglia. And then if you look at the lower brain with Parkinson's, you'll notice that the activity is much more diminished. Why? Well, because the neurotransmitters required for the activity aren't there. And as a result of that, you've got a lot less brain function in that particular region. And you can imagine then that if that's the part that's controlling the motor function, you're going to have some diminished capacity to control your motor function. Another possibility that's out there, well, we should talk broadly about encephalitis. Encephalitis is an inflammation of the brain. Now, you know that it's inflammation of something because it ends in itis, and we talked before that ending itis indicates inflammation. Why encephala? Well, in Greek, what is it? Enkephalos, I think it is. Enkephalos is Greek for brain. So encephalitis means brain inflammation. Okay. What causes this? Could be caused by a bacterial infection, could be caused by a viral infection. It could be caused by all kinds of viruses, like, for example, I don't know, the viruses that are spread by ticks and mosquitoes and other kinds of things could lead to basically an infection in your central nervous system that causes your brain to inflame. Some of the time, we don't know what causes this. We just know that it happens. Sometimes, interestingly, this can be caused by an autoimmune dysfunction. Remember what autoimmune means? Auto means self, and immune is your defensive or immune system, right? So this is when your immune cells mistakenly attack the brain. That's what an autoimmune function is. It's when it identifies a part of you, a part that is self and is not harmful, and attacks it as though it is a non-self invader to your system. The problem with this is that your brain is highly sensitive to pressure. Your brain is highly sensitive to changes in pH. It's highly sensitive to loss in oxygen or glucose. In general, your brain is an extremely sophisticated organ, and any change in physiological condition is going to significantly affect it. As a result of this, by the way, you know this, because if you hyperventilate, the first thing that happens is that your cognitive abilities get diminished, right? Or you get a headache. If you are low on blood sugar because you haven't eaten in a while, what's the first thing that happens? You have difficulty concentrating. Your brain is almost always the part of your body that shows you the first signs that you have difficulty. Dehydration, same thing. What can be one of the first effects of dehydration? Loss in cognitive function, inability to focus, concentrate, things like that, right? So in this case, the brain is swelling. The problem is the brain is in a cranial vault. Remember we talked about that? It is in your skull and it has no place to expand. So as your brain suffers from inflammation, it creates more pressure. And this actually pushes down and downward on your brain and can be really significant. So encephalitis, brain swelling, you got to imagine that's a bad thing. A similar kind of dysfunction is meningitis. Now this one you should be able to decipher. Itis means inflammation. Menin, there we go, relates to what? Meningitis, meningeal layer. Remember what that is? That is that layer around your brain and central nervous system with the dura mater, the tough mater, the pia mater, all that. Well, when you have bacteria in the subarachnoid space, that is the space below that spider web-like layer all around your central nervous system, your brain and spinal column, that bacteria causes inflammation. It expands and does a real bad number, as you can imagine, on your central nervous system. Why would bacteria grow there? Why wouldn't it? It is warm, it's wet, it's a perfect place for bacteria to grow. How does it happen? Well, in different ways. It can sometimes be related to some kind of disease process. It can be related to an injury because remember, there's a blood-brain barrier. So bacteria getting into your central nervous system is not that easy. It happens with children sometimes as well, and it may be a result of growth where different parts of their barrier, if you'd like, between the central nervous system and the rest of their body grow at different rates, and therefore you get somewhat more openings that allow bacteria to move through. But basically, in all these cases, this is bacteria getting into that layer around your central nervous system, the meningeal layer, just under the subarachnoid space, or if you'd like, just outside of the pia mater. That creates inflammation. The inflammatory mechanism takes hold, right? And you start getting swelling. Swelling is not going to be good. But the rest of the inflammatory process also takes hold, which means what have you got? Well, you now get kind of a bit of a kind of scarring. It's a special kind of fibrin clot, so it's really not like scarring you'd have anywhere else in your body. But this is basically scarring that can block circulation of your central spinal fluid, or your cerebral spinal fluid. As a result of this, this can create long-term injury, significant deficits, because you've got these fibrin clots, these scars that result from this inflammation in your central nervous system, not allowing the CSF, cerebral spinal fluid, to circulate as it needs to circulate around your brain and your spinal column. And in a fairly large percentage of folks, this can lead to death. So this is very bad. What's interesting is how we diagnose this, because you've probably heard of spinal taps before, and this is the kind of thing we do a spinal tap for. So here's an image that kind of shows you what's happening. What a physician would do is take a needle, put it through that layer of the dura mater and into the meningeal layer and check the pressure. In the old school ways, you'd actually put the syringe in there and you'd have like a big glass tube, and then the spinal fluid would fill up the glass tube and you'd measure how high up the glass tube it went, and that would tell you the pressure. You're going to look at two things here if you're going to do this. One is you're going to look at the pressure, and especially if you have a bacterial infection, you're going to expect a pretty significant rise in pressure. And then the other thing you're going to look at is the clarity and content of the fluid, because you need to know how to treat this. So basically the physician is going to take a sample of that, bring it into a lab, and they're going to check and see, okay, what kind of bacterial infection is this, or is it a viral infection? Viral infections are possible here. Viral infections are significantly less scary. They don't result in the same increase in cerebral spinal fluid. So you'd expect a lower pressure of cerebrospinal fluid, so you'd expect a lower pressure. Generally, they're self-limiting. So if it's a viral infection, you can feel good about that because it's probably going to go in its own. But if it's a bacterial infection, you're going to have to use some antibiotics. And for that, you're going to need to know what kind of bacterial infection it is. But this can be very scary, whether it's viral or bacterial, and especially scary if it's bacterial, which is true in a lot of cases. For example, like pneumonia is the same sort of thing, which is an inflammation, as you know, of the lung tissue. Bacterial infection, pneumonia, very scary and life-threatening. A lot of people die from it, especially older people or people with compromised immune systems. Viral infections, also called pneumonia, not nearly as scary. So there's times when in medicine we kind of get, in my view, a little bit confusing because we have like pneumonia, which means both something that's not that scary, a viral infection, and something that's super scary, a bacterial infection. In the case of meningitis, the same thing. Bacterial meningitis, very scary and life-threatening. Viral meningitis, scary, not as life-threatening, and probably largely self-limiting, rarely fatal. Okay. What other kinds of issues related to the nervous system? Well, how about varicella zoster? Now, if varicella zoster does not sound familiar to you, then try this one. Chickenpox. You've heard of chickenpox. If you were of my age, you've had chickenpox. But now actually we have a vaccine that's available, so probably most folks that are younger than me, like most of you, have not had chickenpox, or maybe some of you had. But chickenpox is a skin infection. So what happens is the infection of the virus, varicella zoster, starts in the skin. It creates scabs all over the body. I had it as a child, and sure enough, I was covered in all these scabs everywhere. It can be very nasty. But here's the interesting thing. It then travels up the nerve through the dorsal root ganglia, and it lives there for the rest of your life. So in the dorsal root ganglia, this virus just settles there. I shouldn't say it lives there. It resides there, if you'd like, because we generally say that viruses don't live. They aren't really living organisms. They're just bits of DNA that send the wrong instructions to cells. That's beside the point. But what you've got then is this virus that in me and in anybody else who's had chickenpox resides in their central nervous system. The interesting thing then is at any point in their future life, and if you listen to the TV commercials, then you know that about 1 in 3 people who've had chickenpox will have this reemerge. About 1 in 3 people will have that virus reemerge out of their central nervous system and back outward through a dermatome. And this is called shingles. Now, do you remember what the dermatomes are? The dermatomes are those largely horizontal passageways of innervation that come from your spine, your central nervous system, if you'd like, and they were defined in utero, so that now as an adult, they twist down your legs and don't quite take the direct route and go all the way down your arms in somewhat twisted ways, because they were defined when you were about 9 weeks in utero, and then kind of expanded and grew from there. But what's interesting is that shingles then, this reoccurrence of the chickenpox virus, happens along one of those dermatomes, not multiple ones, one of those dermatomes. So here's an image that shows a little bit of the reemergence of the shingles. And you can imagine that there is a horizontal line coming from the spinal column in this person that goes around their upper abdomen right there, and that is the only place where these are going to emerge. So in fact, if this person presented to a physician and the physician saw rashes like that in multiple other parts of the body, you could rule out shingles, because shingles only happens along one of those dermatomes. But shingles can be very significant and very painful. Why is it so painful? Because it's happening in the place where you've got tissue designed to feel pain. This is right on the pain receptors in your skin. So you've got this virus that emerges and creates this rash and this inflammation and dysfunction right where your body is designed to sense pain. So it's extremely painful. It can be also a little disfiguring, because the rashes don't always heal without some significant scarring. So in some cases, for example, if somebody has it along a dermatome on their head or something like that, it can create some significant facial scarring. So it's problematic in that way. Happily now, there's a virus you can take to prevent the reoccurrence of shingles. So that is why you might have seen a TV commercial that talks about taking that virus. It's worth pointing out here, I mean, I'm going to just give you a little bit of my personal story here. It was about 9 months ago or something like that. I just had like a little pain on the head, and I thought, man, I wore a ball cap yesterday. I probably put that thing on too tight. I feel like it irritated my skin right there. But I didn't think anything about it. And then later in the day, I was scratching my head where it kind of hurt, and there was a little bit of a scab there, and I thought, man, that's really kind of, painful and sensitive. I wonder what I did, but I didn't do anything. I didn't smack my head or anything like that. And I mentioned to my wife later, and she didn't think anything about it either. And then it dawned on me and her as we were talking about it that this was shingles. But what's interesting to point out here is, you really shouldn't be diagnosing yourself. You should be going to see a physician, because a physician might have looked at that and thought right away, oh yeah, that's shingles. But it doesn't dawn on me because you don't kind of expect it in your own life, right? But sure enough, just right along here, right along a dermatome, I had some scarring and some significant pain that felt like, it really hurt. And it lasted about a week or so, and then it went away. In that case, really modest. And in most cases, shingles is really modest, but it can be significant. So, medical professionals are encouraging those that are especially older and have had chickenpox in their life to get the vaccine to avoid shingles, just to avoid that complication, because the vaccine has relatively no side effects. So that's shingles. Another possibility that's out there that's worth talking about, I guess, a little bit, just as a life lesson, is Reyes syndrome. Reyes syndrome is really a post-viral complication. It's a rare but serious condition that causes swelling in the brain and liver, and basically it occurs after a viral illness. So somebody could have had chickenpox, or they could have influenza, the flu, and then what happens is you get inflammation in the central nervous system, swelling in the brain, this is not good, and the liver as a result of this virus. It doesn't happen very often, but when it does happen, it becomes very significant because, again, you get inflammation of the central nervous system, and that's never good. Your brain's not going to function, your nervous cells are not going to function well when you've got this increased pressure. It causes significant complications about 25% of cases. So 75% of the time, in a week or two, the patient's fine. But in about 25% of the cases, it's really significant. And in about 10% of the cases, it causes death. And it's fairly common in children. So it's most common in children under the age of about 12 or 15 or something like that. Again, why? Well, it may be because, again, that viral infection has the potential to get through that barrier between the rest of the body and the central nervous system as a result of the growing process of children. It's hard to say. Why am I bringing this up when there's like 1,000 different diseases of the nervous system I could mention? Well, because this is the reason we don't give children aspirin. Aspirin significantly aggravates and complicates this disease or this syndrome. And as a result of that, when small children are sick, we do not give them aspirin. You might think this is weird because you can go to the drugstore and buy children's aspirin. Children's aspirin is good for a fair number of things, but don't ever give it to children. In fact, most of it's been relabeled now, so fairly infrequently is it children's aspirin. In fact, the most common use of children's aspirin is for folks that have heart disease, because we mentioned this before, it blocks the stickiness of platelets and therefore can avoid the creation of a thrombus, a blockage in the cardiac circulatory vessels, if you just take a baby aspirin, an 81 milligram aspirin once a day. So that's the most common use of this. But don't give it to children. Why not give it to children? Because if a child is sick with the flu and you give them aspirin and then they develop Reyes syndrome, this is going to significantly complicate the situation. And since 10% of those that have this syndrome end up dying, roughly, then that's pretty significant. We want to avoid that. So small children, don't get aspirin. Other pain relievers, fine. There are some made for children, but not aspirin. Another complication or disease of the central nervous system you might have heard of is MS, multiple sclerosis. And already from the title, you can imagine what this one means. Sclerosis is that hardening, right? So we talked about sclerotic arteries when we talked about the circulatory system, and we said that that is kind of a hardening and stiffening that doesn't allow the arteries to then flex. Multiple sclerosis is that kind of hardening and stiffening all over your body. What is it? It's an autoimmune disorder. Again, autoimmune disorder. So this is your immune system misidentifying healthy self cells as though they're non-self invaders. So this ends up being a neurological condition where the immune system mistakenly attacks the myelin sheath of your neurons. So remember that sheath, that lipid layer around the axon of your neurons? Your immune system, your defensive system, mistakenly identifies that as a threat and attacks that protective sheath. What happens then is that all around the nerve fibers, those protective sheaths become damaged, like here you can see in this image. That damage is known as demyelination, a fancy word that just means the removal of that myelin sheath. But this disrupts the flow of the nerve signal. And you know this because when I mentioned the myelin sheath earlier, I said that one of the principal purposes and value of the myelin sheath is that it allows for more efficient transmission of that electrical signal through the axon. In this case now, the electrical signal does not pass through the axon effectively. You can imagine what that's going to do, because these nervous signals, these signals through your axons and your neurons, these signals are the things that tell your legs to move and your arms to move and your heart how fast to beat and your digestive system how to function and all kinds of other stuff. All of these things are going to be affected by the deterioration of the myelin sheath around your neuron axons. And so what are going to be the symptoms of this? They're going to be broad ranged. MS is really just a bum deal here. Potentially fatigue, numbness and tingling, muscle weakness and spasms, difficulty walking as a result of that, maybe vision problems, maybe blurred vision, right? Because there are nerves that go to your eyesight, balance and coordination issues, because now your muscles can't quite move and coordinate the way they did before. Your reflexes are compromised. Pain is going to be a factor, right? Because your nervous system is also the one that transmits pain signals. Cognitive difficulty, possibly difficulty concentrating, right? Because your brain is just a bunch of neurons all clumped together with glia cells, right? Bladder and bowel problems. Potentially related to this could be psychological and emotional changes, right? In part as a result of physiological dysfunction, and as part as a result of the emotional strain of living with all these other issues. So you typically see things like emotional changes, depression, anxiety. These symptoms can be intermittent. They can come in periods. They can then you can then go into remission where the symptoms improve or reduce somewhat, and then they could exacerbate again when the symptoms come back and get much worse. This is not good. So multiple sclerosis, folks living with multiple sclerosis are going to have bouts of really bad symptoms that can range from anything from gastrointestinal to cognitive to muscular to balance to vision. And then they might have periods of remission, and then they might have bouts of dysfunction again. It is an autoimmune disorder. We've gotten better at dealing with autoimmune disorders, so people with MS now have better lives than they did 50 years ago, but it's still a really significant disorder. What else? How about ALS? You might have heard of ALS. You might have heard of it as Lou Gehrig's disease. The reason for that is that Lou Gehrig was a baseball player. He played I think about 18 or 19 years on the Yankees in the 1930s and 40s. Is that right? I guess it was 1920s and 30s, because I think it was 1941 or so that he retired because of his illness. The reason I'm pointing out Lou Gehrig is because it's called Lou Gehrig disease. He was a famous baseball player, and then he developed ALS, and he had to stop playing baseball. And he famously sort of made a speech when first off, he voluntarily decided to take himself out of baseball. So he told his coach and manager, look, take me out of the lineup. I just can't do this anymore. And then basically made a speech where he said, I'm the luckiest man in the world. I got to play with the New York Yankees. This has been a fantastic life. And retired, and then I think died about a year or two later. And this became sort of pretty significant popularization of ALS and what ALS was, because Lou Gehrig was a very, very famous baseball player back in the 40s, and it's still sort of called that. But the more appropriate term, ALS, stands for amyotrophic lateral sclerosis. Now that may sound fancy, but at this point in the class, you could probably break that down. Amyotrophic. Myo means muscle. Trophic means nutrients or energy, right? A means lack of. So amyotrophic means lack of muscle energy or nutrients. Lateral just means that it's affecting the lateral neurons, but you don't need to worry too much about that. Sclerosis. We know what sclerosis is, right? That hardening and stiffening and dysfunction. So it is the lack of muscular energy that can lead to dysfunction and hardening. So amyotrophic lateral sclerosis, or Lou Gehrig's disease, is progressive neurodegenerative disease that affects nerve cells in the brain and the spinal column. Basically, it causes a gradual decline in motor function that can lead to muscle weakness, paralysis, and eventually, because it's going to get worse and worse, it's going to expand and grow. So it might begin with just modest muscle weakness or numbness in certain extremities in your legs or arms, something like that. But eventually, you're going to lose all muscle function. So you're going to lose the ability to speak, you're going to lose the ability to swallow, you're going to lose the ability to breathe. And people don't live long when they lose the ability to breathe. There's no cure for it. Here's amyotrophic lateral sclerosis there, and you can see kind of how the neuron is affected significantly, and you can see why we call it sclerosis, because look at that diseased neuron, and you can see how it is smaller, shriveled, diseased. That's the sclerotic neuron, right? Because it's not getting energy and nutrients. So what happens here? Well, it's affecting motor neurons. We talked about that before. It's diminishing their ability to transmit a signal from the brain and the spinal cord into the muscles, because that's what neurons do in this case. The neurons die and they become sclerotic. This leads to the weakness. This leads to the stiffness in the hands, feet, arm, etc. It can be associated with things like muscle twitchiness, for example, difficulty swallowing and breathing happens. And then basically, as it progresses, we don't have a solution for this. It gets worse and worse, and eventually the patient loses the ability to breathe. ALS, amyotrophic lateral sclerosis. Terrible disease, and researchers are still working on how to adequately deal with this. Before we finish up with the dysfunctions and diseases of the nervous system, and I hope this gives you a sense of sort of how, these diseases function. This isn't even by any stretch of the imagination a full summary of all the diseases of the central nervous system. I just picked some that are either instructional in some way or you've heard of. So I think you've heard of Lou Gehrig's disease before. You've certainly heard of dementia before. So I want to talk about some of those and give you a sense of physiologically what they look like. And then some others I picked, like Reyes disease, because I want you to understand why we don't give aspirin to babies, right? So I just picked some. I could go on for hours on all these. But before I leave this topic, I want to talk about one more thing, which is the effect that toxins can have on your central nervous system. This includes drug use, illicit drug use, or improper use of prescribed drugs. And it includes toxins that you may be exposed to accidentally. So let me give you one example, which is organophosphates. Organophosphates are pesticides. And they're used frequently in pesticides, and people spray them around their house and they spray them in their garden. They don't think much about it. But these organophosphates actually inhibit an enzyme in your body called acetylcholine esterase. Acetylcholine esterase means that it is the thing that removes acetylcholine. What is acetylcholine? You might remember I mentioned it before. It is a neurotransmitter. So acetylcholine is a neurotransmitter, and at this point I don't need to review what neurotransmitters are. You should remember. It was like 10 minutes ago we talked about it, right? It's a neurotransmitter that transmits signals usually for something related to the release of fluids. So this neurotransmitter works to, for example, release fluids and activity in your gastrointestinal system, or your tear ducts to allow you to cry, or your nose to allow you to, to create. Well, that can be allergic too, but it's the thing that's going to be signaled there for saliva. So the nerve cell that triggers the production of saliva uses acetylcholine. For pooping, for peeing, there's one that's a fluid. For sweating, all of these things use acetylcholine. That is the neurotransmitter that goes between the nerve and the receptor and sends the chemical signal that basically transmits the nerve signal from the central nervous system saying, whatever, go ahead and pee, or go ahead and poop, or go ahead and lactate, or go ahead, release milk, or go ahead and salivate, or go ahead and cry, tear ducts, etc. You get the idea. Okay, so the esterase removes acetylcholine from the receptor. So this makes sense because you have to realize that a neurotransmitter has to have some way of removing it. Otherwise, you're just going to keep doing that forever. Like your body may want to have you salivate, but it doesn't want to have you salivate forever and ever and ever. So the esterase is going to remove that neurotransmitter so you stop salivating. Okay, so far good. The problem here is that organophosphates, these pesticides, inhibit or block the ability of acetylcholine esterase to work, which means that the acetylcholine stays on the receptor and intensifies that signal. So basically, when you are exposed to this pesticide, acetylcholinesterase does not remove the neurotransmitter acetylcholine from your receptors. Your receptors are inundated with acetylcholine that tells your body pee, poop, salivate, cry, all these things. And the result is you do all these. So when somebody is accidentally exposed to too much organophosphates, let's say spills a pesticide and cleans it up with a rag, is a farm worker exposed to this accidentally, is a homeowner and spraying pesticide in their house and puts out too much of the wrong pesticide in the house and is exposed to this, or a child, for example, exposed to this, you get pretty significant effects because you immediately get salivation, lactate. You're immediately getting like tears and saliva building up. So your mouth is foaming up and water's pouring out. You pee yourself. You poop yourself. You're sweating. All these kinds of things happen all at once. It's a terrible kind of effect, and you need to rush to the hospital right away because there are medications that can remove the acetylcholine temporarily, or disable the acetylcholine and give you relief, but you need those right away. By the way, these kinds of organophosphates are also used as chemical weapons. So in fact, some first responders have like a self-injection needle that they might carry with them in case there would be an attack of this kind of nerve gas. They could inject themselves with something that will give them temporary relief from the symptoms, so you don't have like medical first responders there that are exposed to this toxin that are, unable to help anybody else because they're peeing themselves and pooping themselves and salivating and crying and just completely dysfunctional, right? But the point I want to make here is that there's a lot of toxins that can do this. I could have talked about opioids that basically do the same sort of thing. They overstimulate the receptors that cause you to relax to the point where you're so relaxed you stop breathing and your body stops functioning. Or the chronic exposure to this, which means your gastrointestinal system stops functioning properly because you keep shutting it down with exposure to this toxin. There's a lot of toxins out there that do this, and what they're doing basically is they are blocking the proper function of your nervous system. And that is causing your organs and your muscle tissue to function out of whack, which can be significantly life-threatening. So you want to pay attention to those and the accidental exposure to dangerous things like what you think would be a normal household item, like bug spray and other kinds of things, right? All these are toxins that can really have significant effects on your nervous system. Okay, that's basically it for the nervous system and dysfunctions of the nervous system pathophysiology. I will see you in the next video.